Good morning, y'all. How y'all doing this lovely morning? Hey, James. Hey, Christine. What's up? So I must have slept on my neck the wrong way or something, cause like the side of my neck's all weird and stuff. I don't know. So I suppose I did that. How y'all doing on this Wellness Wednesday, Miss Christine? How's your mama doing today? I saw you said she was coming home. That's so amazing. Hey, hotspot love. Yeah, I'm gonna need to my neck does that sometimes. It'll get stiff and everything else. Like I've always had that problem with it. That is a good thing, Miss Crystal, and I can't wait until you try the MCT and the coconut oil with her and see how that works and all that stuff. How you doing, Hotspot, this morning? How you doing, love? I'm super excited for that. Also, hey CFM Queen, how you doing this morning? Um, Miss Emily, her husband's home with her, and baby's doing well so far. We've been praying for the baby and whatnot. So far, baby's doing good. So, you know, we're gonna still keep a prayer for that baby and for her family right now until baby's completely out of woods. And even then after that, because this is going to be a long road. Anybody who has a child that is born extremely early knows that. It's a long road, you know. Um, I don't know if y'all know anything about micropremies and how that works, and all the complications that they could face. I got super lucky that my son didn't have some of the complications they wanted him to have. Um, I'm super lucky about that. Because I mean, it could always be worse, right? So that's the way I look at all situations of life. It could always be worse. Um, and I'm just lucky that he made it home. He's fine. He's not far from 18 years old. He did, he's amazing. Um, smart, all those good, lovely things. I was going to do an overview today of what Alzheimer's disease is so that people could understand it. And also, a lot of people don't realize that one of the reasons that Bruce Willis stopped acting and all that, hey, Happy, good morning. Don't know, some people don't know the exact story behind that, right? So he has a form of dementia that is very progressive. Um, and I'll show you what um he has. What is it called? I have to look it up right quick. Frontal temporal dementia. Frontal temporal. It's called frontal temporal. We're gonna look that up right quick. Frontal temporal dementia. Okay, and we're gonna look up frontal, and I'm gonna show you what frontal um, dementia is and all those lovely things this morning. I know, right? Miss CFM Queen should be a rep for MCT. Y'all know Hotspot's always in the corner. Always in the corner. And there's Hotspot and Hotspot's alter ego, and they be fighting in the corner, y'all. They be fighting each other. Sometimes I have to separate them. Okay, we're going to share screen this morning. Um, Also, let me go ahead and put up my content disclaimer so that others may see. You know, this is a copyright disclaimer under Section 107 of the Copyright Act of 1976. Allowances made for fair use for purposes such as criticism, comment, news reporting, scholarship, and research. Fair use is permitted by copyright statute that might otherwise infringe. So we're using this for educational purposes and also research and reach one, teach one, and show people what different disorders are like. And if you have a specific disorder that you would like me to look up this morning, um, you may do so by telling me in the chat, and we'll look it up together. So we're going to look up first what frontotemporal dementia is. This is what Bruce Willis deals with. FTD is an umbrella term for a group of brain diseases that mainly affect the frontal and temporal lobes of the brain. These areas of the brain are associated with personality, behavior, and language. In frontal temporal dementia, parts of these lobes shrink, known as atrophy. Symptoms depend on which part of the brain is affected. Some people with FTD have changes in their personalities. They become socially inappropriate, may be impulsive, or emotionally indifferent. Others lose the ability to properly use language. FTD can be misdiagnosed as a mental health condition or as an Alzheimer's disease, but FTD tends to occur at a younger age than does Alzheimer's disease. It is often begins at the ages of 40 and 65, though it can occur later in life as well. FTD is the cause of dementia about 10 to 20% of the time. Symptoms of FTD differ from one person to the next. Symptoms get worse over time, usually over years. People with frontal FTD tend to have clusters of symptom types that occur together. They also have more than one cluster of symptom types. The most common symptoms of FTD involve extreme changes in behavior and personality. These include increasingly inappropriate social behavior, loss of empathy or other interpersonal skills, for example, not being sensitive to another person's feelings, lack of judgment, loss of inhibition, lack of interest, also known as apathy. Apathy can be mistaken for depression. Compulsive behaviors such as tapping, clapping, or smacking lips over and over. A decline in personal hygiene, changes in eating habits. People with FTD typically overeat or prefer to eat sweets and carbohydrates. Eating objectives, compulsively wanting to put things in the mouth. Speech and language symptoms. These conditions can cause increased trouble with using and understanding written and spoken language. People with FTD may not be able to find the right words to use in speech. Trouble naming things. People with FTD may replace a specific word with a more general word, such as it for pen, no longer knowing the word's meaning. Having hesitant speech that may sound telegraphic by using simple two-word sentences. Making mistakes in sentence building. Movement conditions, tremors, rigidity, muscle spasms or twitches, poor coordination, trouble swallowing, muscle weakness, inappropriate laughing or crying, falls or trouble walking. Causes. In frontal lobe dementia, the frontal and temporal lobes of the brain shrink and certain substances build up in the brain. What causes these changes is usually not known. Some genetic changes may have been linked to frontal temporal dementia, but more than half of the people with FTD have no family history of dementia. Researchers have confirmed that some FTD gene changes also are seen in ALS, which is amyotrophic lateral sclerosis. More research is being done to understand the connection between the conditions. Um, as we all know, dementia is the first thing. Um, Oh, that's another good one, Miss Crystal Ann. Actually might add that to the list this morning. Because that's something not a lot of people know about. You know, and if we can get information out to people to understand different conditions and different problems and help each other out as humans, people might be able to understand it better, and they might, not, because a lot of people don't understand like what cerebral palsy is or how it affects different people. Some people with CP don't have learning disabilities, some do. CP can be physical for some. It can be anywhere from mild to moderate to severe. And just like chlamydia malformation, a lot of people may not understand what it is. And understanding conditions can sometimes help us understand the person better. Just like, let's say you have something that others may not understand. Well, maybe they have a family member that is dealing with that, or a cousin. Epilepsy, for life. Yes, epilepsy is another thing that people don't quite understand. Now, there's different forms of epilepsy too. Not every person who has epilepsy is going to try to swallow their tongue. Not every person who has epilepsy, there's different kinds of seizures. There are some seizures that a person doesn't even look like they're having one, and you wouldn't know that they're having them. There's different looks to epilepsy, and that's it's like you can't judge a book by its cover. It's the same thing with a lot of these disorders. Um, you know, Not a lot of people do understand what epilepsy is and the different forms of epilepsy. We're going to go over that too because I think that's cool. Thank you, Ford for Life, for that. Um, okay, so right now, actually, I'm going to switch to this tab. We're going to talk about the uh, Chiari malformation first. Okay, an overview of it. Um, Chiari malformation is a condition in which brain tissues extend into the spinal canal. It occurs when part of the skull is misshapen or smaller than it is typical. The skull presses on the brain and forces it downward. CM is not common, but increased use of imaging tests has led to more diagnosis. Healthcare professionals group uh, Chiari malformation into three types. The type depends on the anatomy of the brain tissue that is pushed into the spinal canal. The type also depends on whether there are developmental changes of the brain or spine. Chiari malformation type 1 develops as the skull and brain are growing. Symptoms may not occur until late childhood or adulthood. The pediatric forms of Chiari malformation are type 2 and type 3. These types are present at birth, which is known as congenital. Treatments of Chiari malformation depends on the type of symptoms. Regular monitoring, medicine, surgery are treatment options. Sometimes no treatment is needed. Symptoms, many people with Chiari malformation have no symptoms and don't need treatment. They learn they have Chiari malformation only when the tests are performed for unrelated conditions. But some types of Chiari malformation can cause symptoms. The more common types of Chiari malformation are type 1 and type 2. These types are less serious than the rarer pediatric form type 3, but symptoms can still disrupt life. In Chiari malformation type 1, symptoms usually appear during late childhood or adulthood. Bad headaches are the classic symptom of Chiari malformation. They generally occur after certain coughing, sneezing, or straining. People with Chiari malformation type 1 can also experience neck pain, unsteady walk and trouble with balance, poor hand coordination, numbness and tingling of the hands and feet, dizziness, trouble swallowing. This sometimes happens with gagging, choking, and vomiting. Speech changes such as hoarseness. Less often, people with Chiari malformation may experience ringing or buzzing in the ears, known as tendinitis, weakness, slow heart rhythm, curvature of the spine, known as scoliosis. The curvature is related to the spinal cord impairment. Trouble with breathing. This includes central sleep apnea, which is when a person stops breathing during sleep. Chiari malformation type 2, a greater amount of tissue extends into the spinal canal compared to with that of Chiari malformation type 1. Symptoms can include those related to a form of spina bifida called meliomeningocele cell. Chiari malformation type 2 nearly always occurs with Melia-Gileoside. In Melia-Gileoside, the backbone and the spinal column canal don't close properly before birth. Symptoms may include changes in breathing pattern, trouble swallowing, such as gagging, quick downward eye movement, weakness in the arm. Chiari malformation type 2 is usually noted with ultrasound during pregnancy. It may also be diagnosed after birth or in early infancy. Chiari malformation type 3 is the most serious type of the condition. A portion of the lower back or of the brain, known as the cerebellum. Why did I just say that? The other word? I don't know. Cerebellum or the brainstem extends through the opening in the skull. This form of Chiari malformation is diagnosed at birth or during pregnancy with a ultrasound. Chiari malformation type 3 causes brain and nervous system issues and has a higher rate of death. Causes. Chiari malformation type 1 occurs when the skull is too small or misshapen. The part of the skull contains the area of the brain called the cerebellum. The skull puts pressure on and crowds the brain. As a result, the lower part of the cerebellum, known as the tonsils, are pushed into the upper spinal canal. Chiari malformation type 2 is nearly always associated with a form of spina bifida called myelomeningocele. When the cerebellum is pushed into the upper spinal canal, it can interfere with the usual flow of cerebrospinal fluid. This protects the brain and spinal cord. Cerebrospinal fluid can build up in the brain or spinal cord. It can cause signals transmitted from the brain to the body to be blocked. Also, the pressure from the cerebellum on the spinal cord or lower brainstem can cause symptoms. Risk factors. There are no evidence that Chiari malformation runs in families. However, research is possible. Hereditary component is still in its early phases. Complications of Chiari malformation may have no symptoms and they don't need treatment. Others, Chiari malformation gets worse over time. It leads to serious complications. Complications may include hydrocephalus. Hydrocephalus occurs when too much fluid builds up on the brain. This can cause trouble with thinking. People with hydrocephalus may need a flexible tube called a shunt place. The shunt diverts the brain's excess cerebrospinal fluid to a different area of the body. Spina bifida. Spina bifida is a condition in which the spinal cord or its covering isn't fully developed. Part of the spinal cord is exposed, which can cause serious conditions such as paralysis. People with Chiari malformation type 2 usually have a form of spina bifida called myelomeningocele. Spiromelia. Some people with Chiari malformation also develop a condition called spiromelia. In people with this condition, a cavity or cyst called a syrinx forms within the spinal column. As the syrinx grows, it can press on the nerves and cause pain and weakness and stiffness. Tethered cord syndrome is a condition which the spinal cord attaches to the spine and causes the spinal cord to stretch. This can cause serious nerve and muscle damage in the lower body. So, it's something that, good morning, Watcher. Hey, Love. Hey, Freeside. Hey, Montauk. Hey, everybody. Sorry, I was over there reading some, information on, the Chiari malformation. Let me ask you this question, Miss Miss Crystal. With you have type 1. So speech problems are a big problem for you. When did you find out, like, when you had it? Did you find out when you were young? Did you find out when you were older? Because some things go misdiagnosed. We all know how that works. So a lot of the bigger words, like even saying Chiari malformation itself would be a problem, right? Thank you, Watcher Love. Thank you, beautiful. You so that would have been 2019. would have been 10 years. 17 years ago, Miss Crystal. So you were older when that happened. Okay. Okay. Um, sometimes oh yeah. Totally. Uh I will say that it's sad that they didn't catch that beforehand, but because yours is it's not a mild form, but it's milder than stage 2 or stage 3. Um, that's why sometimes in type 1, um, it doesn't occur till late childhood or adulthood because it is something that it's a little different than type 2 and type 3 occur when in utero. Um, type 1, basically, to explain it to everyone, develops as the skull and brain are growing. So, somewhere along the way, as things were growing for you, it basically started pressing down. Um, and the first symptoms are bad headaches, and that's how a lot of people find out they actually have it. And then the neck pain, the unsteady walk and balance, poor hand coordination, numbness and tingling, dizziness, trouble swallowing, speech changes. um so what I'm seeing here is that um that's how most people find out they actually have it, is a bad headache starts, and then it goes, woo, this is what's wrong. Have they ever thought to ask, or thought about, like, a shunt? Have you had any problem with that? I know people who have had those. Um, oh, I got my Crocs, but I'm gonna tell you, there's some more Crocs that I want. Mhm. I hope that with Miss Crystal, with this condition, I know that it can cause other conditions because of the way it presses down. It can cause other problems, right? As we were sitting here looking at, the complications, um, of what it can cause, um, depending on treatment and everything else. It says Chiari malformation gets worse over time and leads to serious complications. So I hope and pray that you do not have serious complications. And I hope that as time goes on, your treatment works and none of this, like, I don't think you're gonna get spina bifida, hopefully not. Hydrocephalus is a thing that could possibly happen. And you might need a shunt eventually, or may have already had a shunt put in. Um, that's usually the main one that I hear about, is the shunt. Oh, thank you, Miss Crystal Ann. Ooh, Gator Wader camp shoes. Ooh, that sounds good. Hey, Miss Twin Mama. Hey, beautiful. That is good that you haven't had to have the shunt yet, but that is like one of the most things that I see with that situation is because of the pressure on the brain creates more fluid, and because of the fluid, you know what I'm trying to say, like, that's a complication. Um Now the decompression surgery, I think I know what you're talking about, because they talk about that with someone with my neck condition also, to where they pretty much, if I'm not mistaken, is the decompression the one you're going to have on the spinal cord itself or on the brain itself? Because I've heard of them doing it on, the bottom of the spine. Thank you, Twin Mama. I can't wait to see y'all show when y'all come out with it. Happy said he's owed back pay or she's owed back pay. Happy, I never did ask if you were she or a he. Damn it. I just consider you a happy bird. Oh, okay. That's the one. I know what you're talking about. They take a little portion, kind of like, okay, I know which one you're talking about now. It's a form of brain surgery in a way. They take a little portion out of your skull to, and if I'm not mistaken, girly girl, okay, so I could say you a ladybird now. Happy, I might call you my ladybird if that's okay. So they basically take out, thank you, Hotspot Love, for the gifted memberships. Groove and Gary got it. Glass City Girl. Tay Bay. I love me some Tay Bay now. Crystal with a K. And Mr. Grumpy Italian. Hey, Mr. Grumpy Italian got one. That's awesome. But we're also going to switch over here to types of seizures, because I'm not sure with Chiari malformation that it could possibly cause a seizure disorder. Um, so maybe it'll be a good idea to know about these things. So if this ever happens, you'll know, because some people don't realize when a seizure happens, because there's different types, right? Um, basically recognizing the types, right? There's focal onset, which is aware, and your impaired awareness. Like you kind of know what's happening, right? And focal to bilateral tonic clonic, it's a motor, non motor, generalized onset, impaired awareness, tonic clonic, other motor, non motor, abstinence, unknown onset, which is motor, tonic clonic, other motor, non motor. Um, let's types of seizures. There's different types. Let's look at the types. There are many types of seizures, each one causing different physical and behavioral changes. Not all seizures are due to epilepsy, a condition characterized by reoccurring seizures. Some people only have one seizure in their lifetime. Seizures are classified based on the parts of the brain involved. They include focal and generalized seizures. Focal seizures occur when abnormal electrical activity starts in one area of the brain. This used to be called a partial seizure. So I know y'all have heard of that in the past. It was an old term called a partial seizure. Then you have generalized seizures, start in both sides of the brain. Sometimes a focal seizure can become generalized if it spreads. Focal seizures are common and occur on one side of the brain. Approximately 60% of the people with epilepsy have focal seizures. These types include focal awareness seizures, focal impaired awareness seizures, focal to bilateral tonic clonic seizures, galactic and di- diachrystic seizures, focal aware seizures. During a focal aware seizure, previously called a simple focal seizure, you do not lose consciousness. You are aware of yourself and your surroundings. Symptoms can include one or more of the following: unusual head or eye movement, dilated pupils, tightened muscles, numbness, tingling, sensations of crawling on the skin, hallucinations, nausea, sweating, facial flushing, vision changes, difficulty speaking, and sensation of deja vu. These seizures may last between a few seconds to 2 minutes. Focal impaired awareness seizures. Um, a focal impaired awareness seizure happens when your consciousness is partially or completely lost. It used to be called a complex focal seizure or complex partial seizure. You won't be aware of yourself and your surroundings, but you'll seem awake. Possible symptoms include inability to respond, blank stare, appearance of daydreaming, lip smacking, screaming, crying, or laughing, repeating words or phrases, performing involuntary physical actions like jerking, becoming rigid and still. This seizure typically lasts between 1 minute to 2 minutes. After the seizure, you may feel sleepy and confused. Focal to bilateral tonic clonic seizures. This seizure occurs when a focal impaired awareness seizure becomes generalized or spreads to both sides of your brain. It can be called a secondary generalized seizure. It often causes chronic jerking, tonic muscle stiffness, jerking arm, leg movements can occur along with facial twitching, impaired control of the bowel or bladder, and repeated flexing and relaxing of the muscles. Other symptoms include loss of consciousness, falling to the floor, crying, groaning, biting your tongue or inside of your cheek, difficulty breathing. These seizures last between 30 seconds and 3 minutes. Galactic and dicrastic seizures. These seizures begin in the hypothalamus, which is located at the base of brain. Galactic seizures are laughing seizures, involve involuntary laughing. Diacrastic seizures cause involuntary crying. You don't lose consciousness during these seizures. Types of generalized seizures. There are many kinds of generalized seizures, including general tonic-clonic seizures, GTC, tonic seizures, clonic seizures, absence seizures, myoclonic seizures, atonic seizures, infantile and epileptic spasms. GTC, previously called a grand mal seizure, begins on both sides of the brain. It is different from a focal to a bilateral tonic seizure, which starts on one side then spreads. It consists of two types of movements. The tonic and clonic movement involve muscle stiffening, loss of consciousness, falling to the floor, crying, groaning, biting your tongue or inside of your cheek, difficulty breathing, rapid jerking movements, and facial twitching, impaired bladder or bowel control. A GTC seizure lasts 1 to 3 minutes. Tonic seizures. A tonic seizure can cause muscle stiffening. It sometimes occurs during sleep and involves muscles in the back, legs, and arm. Tonic seizures may cause people to fall down if they are standing or walking when the seizure occurs. Clonic seizures. These seizures only involve repeated muscle jerking or clonic movements. Absence seizures, previously called petit mal seizures, are often mistaken for daydreaming. There are two types. Typical absence seizures. This seizure causes sudden symptoms like blank staring and fluttering eyelids. It generally lasts less than 10 seconds. Atypical absence seizures. This seizure causes symptoms that develop slowly, including blank staring, eye blinking, hand motions, and fluttering eyelids. It usually lasts 20 seconds or longer and is often part of a neurodevelopmental epilepsy syndrome. Neurodevelopmental. Can I speak today? Absent seizures are more common in children than in babies or adults. Myoclonic seizures cause sudden muscle jerking without impaired consciousness. It typically involves muscles on both sides of the body. Generally, these seizures last 1 to 2 seconds. They often happen multiple times within a day or several days. Atonic seizures. In an atonic seizure or drop attack, you suddenly lose muscle tone. Symptoms include falling from a standing position, sudden head dropping, inability to respond. Infantile or epileptic spasms. An epileptic spasm involves brief extended or flexing of the arms, legs, or head. It commonly affects children younger than 2 years old. It occurs in an infant. It is often called an infantile spasm. These spasms last 1 to 3 seconds. They usually reoccur every few seconds over 10 minutes, which can happen several times a day. Conditions that mimic epileptic seizures. Some disorders may cause symptoms that look like epilepsy. However, those disorders require different treatment and care. They include cerebral seizures. A cerebral seizure occurs when a child between the ages of 6 months and 5-year-old has a fever. It may be first sign that your child is sick. There are two types: simple cerebral seizure that lasts less than 15 minutes. Only one seizure occurs in 24 hours. Complex febrile seizures that last more than 15 minutes and may happen multiple times in 24 hours. Cerebral seizures tend to run in families and are more common in babies and children than in adults. Non-epileptic events or pseudo seizures are associated with extreme stress and psychological disorders. They aren't caused by abnormal changes in the brain's electrical activity. These seizures most commonly affect people who have epilepsy, PTSD, anxiety disorder, major depressive disorder, personality disorder. NEE may look like a GTC seizure, but unlike GCC, they cause muscle jerking that's out of phase and not rhythmic. Non epileptic events are more common in adults than in babies and children. Tics. Tics are repeated patterns of involuntary movement that happen while a person is conscious. This usually affects one side of the face, but they can affect the neck, shoulders, and other areas of bodies. They can come in the form of physical tics or verbal tics. Some conditions involving tics are transit tic disorder, facial tic disorder, chronic motor tic disorder, or Tourette's syndrome. While tics can be suppressed temporarily by the person experiencing them, they often have to be expressed once the person relaxes. Types of seizures in adults. In adults, the most common seizures are focal awareness seizures, focal impaired awareness seizures, focal to bilateral tonic clonic seizures, galactic and diachrystic seizures, generalized tonic clonic seizures, clonic seizures, absent seizures, myoclonic seizures, atonic seizures, and non-epileptic events. Do all seizures have the same cause? Any event or condition that disrupts the brain can cause seizures. There are many possible causes. Examples include neurological disorders, birth trauma in newborns and infants, congenital brain defects, brain infections such as meningitis, fever, stroke, brain tumor, head injury, drug or alcohol misuse, very low blood glucose or very high blood glucose, electrolyte imbalance, and certain medications. Sometimes the cause of the seizure is unknown. Complication and risk of seizures. Falls and slips, tongue lacerations from biting, pregnancy complications, drowning while in water, motor vehicle accidents, sudden unexpected death syndrome. What to do if you're having a seizure? Warning signs can include a sense of deja vu, a feeling of confusion or diminished awareness, twitching of the face, arms, or leg, any symptom pattern that usually precedes your seizure. If you notice these warning signs, here's what you should do. Find a safe area without hazardous items or furniture. Loosen clothing around your neck. Let someone know what is happening. If you are driving, pull over. If you're near water or a heat source like a campfire, move away. Follow your seizure's action plan. Consider lying down or sitting. How do you help someone who is having a seizure? Remove hard or sharp items from their surroundings. If the person is standing, gently hold them and guide them to the floor. If the person is on the floor, carefully turn them on their left side to help them breathe. Remove their eyeglasses. Place their head on something soft like a folded jacket. Loosen any ties, scarves, or clothing around the neck to help them breathe. Don't hold them down during a seizure. And now they'll tell you don't put anything in their mouth. Don't offer them food or water until they're fully awake. Speak calmly as they wake up. Um, they used to tell you years ago to stick something in the mouth of a person who was having a grandma seizure. Now they tell you not to do that. Um, okay, you make sure you have a good day, Miss Crystal, with your mom. Huggies. So the thing about, and thank you, twin mama, and thank you, get to know. Sorry, y'all, I was over there reading. Y'all know I be reading sometimes. So basically, anybody that has a general seizure disorder or any kind of seizures, they used to tell you to put something in to keep them from biting their tongue. Now they tell you not to do that. You know what I'm saying? They tell you not to. And take care, get to know. I hope you have a good day. And I hope you have good work and nothing bad, safe travels, all that. Um, but literally, with seizure disorders and different kinds, you can be aware, and sometimes some people don't even realize they have a seizure disorder at first until it happens multiple times and they realize something's wrong, because there are seizure disorders where it's just like you just all of a sudden start jerking and you don't know why, but you're physically you're there. You know what I'm saying? And so, but they used to tell you to stick something in their mouth. You don't do that anymore. They tell you now to turn the person on their side, because something else that can happen when people have seizures is they can absolutely sometimes it make them upchuck and they can aspirate. So they'll tell you to turn the person on the side also, because sometimes they try to swallow their tongue. That opens their airway when you turn them on their side. So they do tell you to do these things now. In the past, they told you to stick something in their mouth to keep them from swallowing their tongue or biting their tongue. Remember, they used to tell us they'd swallow their tongue. They tell you not to do that nowadays. Does anybody in here know anybody that has seizures or have had to deal with that situation, or possibly you yourself may have them? My brother who passed away, which I've told y'all that my brother was a special needs case. Um, he had grand mal seizures. He had epilepsy, and they were very scary. Seizures are very scary. They really are. They're scary to look at. They're scary to see. Um, you know, and having to try to help someone with it. And then, I was gonna show this video over here so that people could understand the different types of epilepsy and what epilepsy truly is. So let's watch this video together, y'all, so we can learn some things.
I'm Oren Davinsky, an epilepsy specialist at NYU. In this section, we're going to discuss seizure types. And it's very, very important for people to understand the different types of seizures, because which type of seizure has great implications for activities of daily life, whether certain sports or driving may be safe. They also have great impact on understanding which medications may be most effective, and even which medications may potentially be harmful. There are many types of seizures, but the different ones are relatively easy to learn and the broad ranges are easy to master. In this section, you'll learn about all the different types, especially the most important and common types that affect children and adults. As you go through these informational pages, if you have any questions that remain about seizure types or want more information, please contact the Epilepsy Foundation.
That was an awesome little video. I thought it was gonna have more information. But yeah, it does go down to the onset of the seizure, when the seizure starts, a person's level of awareness during a seizure, and whether movements happen during a seizure can, tell you which kind of seizures you're having, you know? Well, I guess that don't play. I was going to play that little snippet right there. Um, and if you don't know what type of seizure a person has, I've had friends that didn't know they had seizures until they actually, when we were kids, we had those. Good morning, Michelle. Well, you have a good day with the the grandbabies. Thank you for saying. For unknown reasons, you had grandma's hotspot for unknown reasons. Um, a lot of people sometimes it onsets for no reason and it goes away. Um, I have heard of that before. Um, and then sometimes with seizure disorders, um, you know, people don't find out, especially the ones. So you outgrew them. I've heard of that too. I've heard sometimes that kids will have them, but then they don't have them when they get older. Some of my friends didn't know they were epileptic. Remember when we all found out when they had strobe lights and they started using them during like pep rallies and different things like that? And we found out that they had, some people found out they had seizures by that. And when they started having to put the warnings on certain video games, hey, Mr. Buster, um, and they had to start putting like, the like certain video games now will tell you if you have a seizure or if you have a seizure disorder or this may cause that. And we actually, some people I knew in high school who didn't even know that they had a seizure disorder found out during the middle of a quite literal pep rally. they turned on the strobe light, turned off the lights, and people just started dropping like flies. They didn't give no, and that's when they started having to tell people who had seizure disorders to walk out of the pep rallies when they were using those things. I remember the first time they did it, they didn't give a disclaimer. They didn't do none of that because they didn't know that that would cause a seizure in people, right? And so some of my friends actually found out they had a seizure disorder by accident. Didn't know they had it because they had never had one previously, but it onset the seizure, right? They'd never had one previously, but for some reason, there's certain light things that can onset seizure for certain people. And I had a friend who just dropped right beside me. I didn't know she was epileptic. And I grabbed her before she hit the concrete, before she hit the bleachers and the concrete, helped her, lay down. And um, we, had the basically ended up having to turn off the strobe right away because, of course, all of us kids started going, ah, screaming. They were screaming all over the place because kids started dropping like flies. And they had to turn off the strobe and they turned on the lights real fast. And there was teachers rushing everywhere. It was crazy. But yeah, you feel so helpless trying to help someone with a seizure because you can't fix it. You can't take it away, right? All you can do is be there by their side, talk to them very calmly, um, and try to pull them out of the seizure. And the best way to do that is to speak to them with a calm voice and all these other things, and you know, just keep talking to them, rub their hair, just relax them as much as possible. Because for some reason, the relaxation um, helps seizures. That's crazy happy, but it's so sad too. Could you imagine not like because you're diabetic, right? And you go into a grandma that happened to you and then you wake up and learn what happened? Could you imagine having to live with that? Could you imagine having to live with that? Like, because when those grandma seizures happen, you're not conscious. You don't know what you're doing, right? You have no idea what's going on when you go through a grandma. Yeah, and I will say this, Hotspot, even though you haven't had a seizure in years, I would be very careful being around strobe lights. And when you see those warnings on like video games or TV shows that state that they can cause seizures, I would be very careful around that. Even though you outgrow it or you don't need medication because you're not having them, anymore, there's still that possibility that you could have them because of the past having them, right? So I'd be very, very, very careful on situations like that. And speaking of diabetes, a lot of people actually do have to live with diabetes, or they're pre-diabetic, or they have gestational diabetes. I am going to tell you the different types. There's type 1 and there's type 2 diabetes, right? Um, some people, especially if they have pre-diabetes, gestational diabetes, or type 2 diabetes, may not have the same symptoms in a type 1 diabetes symptoms, tend to come on quickly and be more severe. Some of the symptoms of type 1 diabetes and type 2 diabetes are feeling more thirsty than usual, urinating often, losing weight without trying, presence of ketones in the urine. Ketones are a byproduct of the breakdown of muscle and fat that happens when there's not enough available insulin. Feeling tired and weak, feeling irritable, or having other mood changes, having blurred vision, having slow healing scores, getting a lot of infections such as gum, skin, and vaginal infections. Type 1 diabetes can start at any age, but is often started during childhood or teen years. Type 2 diabetes, the more common type, can develop at any age. The type 2 diabetes is more common in people older than 40, but type 2 diabetes in children is increasing. Actually, one of my friends is type 1. She's insulin resistant. Um, how insulin works. Insulin is a hormone that comes from the gland behind and below the stomach called the pancreas. The pancreas releases insulin into the bloodstream. The insulin circulates, letting sugar enter the cells. Insulin lowers the amount of sugar in the bloodstream. As the blood sugar level drops, so does the secretion of insulin from the pancreas. Glucose, a sugar in a source from the cells that make up muscle and other tissues. Glucose comes from two major sources, food and the liver. Sugar is absorbed into the bloodstream where it enters cells with the help of insulin. The liver stores and makes glucose. When glucose levels are low, such as when you haven't eaten in a while, the liver breaks down stored glycogen into glucose. This keeps your glucose level within a typical range. The exact cause of most types of diabetes is unknown. In all cases, sugar builds up in the bloodstream. This is because the pancreas doesn't produce enough insulin. Both type 1 and type 2 diabetes may be caused by combinations of genetic or environmental factors. It is unclear what those factors may be. Risk factors for diabetes depends on the type of diabetes. Family history may also play a part in all types. Environmental factors and geography can add to the risk of type 1 diabetes. Sometimes family members of people with type 1 diabetes are tested for the presence of diabetes immune system cells, autoantibodies. If you have these autoantibodies, you have an increased risk of developing type 1 diabetes. But not everyone who has these develop type 1 diabetes, but not everyone, race or ethnicity also may raise your risk of developing type 2 diabetes. Although it's unclear why, certain people, including Black, Hispanic, American Indian, and Asian American people, are at a higher risk. Prediabetes, type 2 diabetes, and gestational diabetes are more common in people who are overweight or obese. Complications: heart and blood vessel cardiovascular disease, in risk for that. These can cause coronary artery disease with chest pain, angina, heart attack, stroke, and narrowing of the arteries. Arteriosclerosis. If you have diabetes, you're more likely to have a heart disease or stroke. Nerve damage from diabetes. Too much sugar can injure the walls of the tiny blood vessels, the capillaries, that nourish the nerves, especially in the legs. This can cause tingling, numbness, burning, pain that usually begins in tips of the toes or fingers and gradually spreads upward. Damage to the nerves related to digestion can cause problems with nausea, vomiting, diarrhea, or constipation. For men, it may lead to erectile dysfunction. Kidney damage from diabetes. The kidneys hold millions of tiny blood vessels clustering glomeruli that filter waste from the blood. Diabetes can damage this delicate filtering system. Eye damage from diabetes. Diabetes can damage the blood vessels of the eye that could lead to blindness. Foot damage, nerve damage in the feet, or poor blood flow to the feet increase the risk of many foot complications. Skin and mouth conditions. Diabetes may leave you more prone to skin problems, including bacterial and fungal infections. Hearing impairment. Hearing problems are more common in people with diabetes. Alzheimer's disease. Type 2 diabetes may increase the risk of dementia, such as Alzheimer's disease. Depression related to diabetes. Depression symptoms are common in people with type 1 and type 2 diabetes. In babies, complications in your baby can be caused by gestational diabetes, include excessive growth. Excessive glucose can cross the placenta. Extra glucose triggers the baby's pancreas to make extra insulin. This can cause your baby to grow too large. It can lead to a difficult birth and sometimes a need for a C-section. Low blood sugar. Sometimes babies of mothers with gestational diabetes develop low blood sugar, hypoglycemia, shortly after birth. This is because their own insulin production is high. Type 2 diabetes later in life. Babies of mothers who have gestational diabetes have a higher risk of developing obesity and type 2 diabetes later in life. Death. Untreated gestational diabetes can lead to a baby's death, either before or shortly after birth. Complications in the mother. Preeclampsia. Symptoms of this condition include high blood pressure, too much protein in the urine, and swelling in the legs and feet. Gestational diabetes. If you've had gestational diabetes in one pregnancy, you're more than likely to have it again with the next pregnancy. To prevent type 1 diabetes cannot be prevented, but the healthy lifestyle choices that help treat pre-diabetics, type 2 diabetics, and gestational diabetes can also help prevent them. Eat healthy foods. get more physical activity, lose excessive pounds. Sometimes drugs are an option. They have oral diabetes meds now, such as metformin, glucosamine, formetin. Others may lower the risk of type 2 diabetes, but healthy lifestyle choices are important. If you have prediabetes, have your blood sugar checked at least once a year to make sure you haven't developed type 2 diabetes. So basically, if we're looking at the overview of it, right, and how it affects the body, with type 1, you can't, there's no cure for type 1. Type 2, however, can potentially be reversible, especially if you're pre-diabetic, and or they can get your A1C down to normal. It's called a A1C, right? And if you can get your A1C into normal ranges, there's a possibility you won't have to take insulin anymore. If you can get it under wraps. Not saying that the diabetes is going to completely go away if you're diagnosed with type 2 diabetes. It will never fully go away. So for the rest of your life, you'll have to watch your sugar intake. But you can cut off the fact that you don't have to take insulin, right? If you get everything under wrap with diet, exercise change, losing weight, things of that nature. If you're pre-diabetic, you can try to do those things to try to help you from developing type 2 diabetes. Type 1, though, you were on dilatin and phenobarbital. I've heard of that. I had a hey Indigo Love, hey beautiful. I have a friend of the family who had their daughter had a tumor in her brain. And that, hey Racing Stars Love, that tumor that was in her brain caused seizures and caused a bunch of different problems for her. And she had to, she's in a care home now because her parents passed away, and so did her older sibling that was taking care of her. And that's really sad because she's kind of violent, and it's not really her fault. She has the mind of a 5-year-old or less. Her brain will never develop past that because of the amount of tumors that are in her brain. She's lucky to be alive, and stuff like that, but it's really sad in general, you know. And Hotspot, I am so sorry that you had to deal with that, but I'm glad you're doing better and that you're not having to take those medications and you've not had a seizure in a long time. In a moment, I am going to have to get off here. I got to go do some stuff in town. I got to go take care of some business. I got to go get some medicine, go to the, store and get some food and all that good lovely stuff, and be an adult. Hey, Miss Jill. Now, if y'all didn't know it, Miss Jill's comfort zone. She's an amazing lady. She does a poetry contest every year. And a lot of times I've told her she should just do poetry shows for the fun of it. Just for the fun of it. Because a lot of people love her poetry show. She does cooking, bunch of different stuff. Like, she has a really great content on her channel. I'm actually fixing to share you her channel for y'all who want to subscribe to Miss Jill. She's absolutely a sweetheart. She even does, like, just to give you an overview, like if you right here looking at her channel, Instant Pot, kicking greens and smoked turkey tails. That's her introductory video, right? She's been doing walk with me's. I don't know if your crafting channel's on here. Don't you just still do crafting stuff, Miss Jill? I know you do a lot of cooking, but so I know sometimes you be doing crafting and different things like that. But so Miss Jill does a lot of good cooking. If y'all want to see some good cooking over there, and you just want to watch, y'all know I love good food. Orin, I love, I'm fluffy and I love food. Um, and she does some amazing things on that. If y'all didn't know, she vlogs a lot, does a lot of, just good stuff, just good stuff. Yeah, see, I thought she was still doing your crafting, Miss Jill. I gotta try to find the other channel, so because I know there's some people on here that do stuff like that. They're not a part of any of the drama or mess or any of that stuff. And they like crafting, you know what I'm saying? They like stuff like that. Um and I know that, I like to promote everybody if I can possibly. Okay, JCZ crafting and vlogs and more. Okay, let me look that up because I know it's not associated with your other channel. JCV. JCZ. Okay, JCZ. Crafting. Crafts. Vlogs. And more. Okay. Let's do the answer. Oh, I'm gonna get this channel for y'all. For those of I'm subscribed, so it popped right up, Miss Jill. And let me go ahead and share this out. This is her crafting channel where she does different craft because I know a lot of y'all like crafting and stuff. And so this right here is her crafting channel. And she does a lot of crafting and they do really good stuff over there. And um Miss Jill, I've always done that. If I know somebody got some good stuff, I got to share out the new channel. Twin Mama, do you have it shared on your wall, the new channel that you and Miss Danny and y'all made? Because I need to put that in here for folks who want to watch the new channel that y'all are doing. Um, Let me see if you put it in a post right quick. And then I do have to get off here in a minute, but there it is. I did find it. I got it. I got it, Twin Mama. This is the new channel that Miss Danny, Miss Betty, and Miss Twin Mama are going to be doing a show called The Third Degree. I don't know what all they're going to be doing on here, but they're going to be starting their show soon. And this is it right here. For those who want to subscribe to that channel. I love networking and I love everybody getting to know each other from different sectors of YouTube and all of us, coming together and having amazing things. Like, I think that's one of the awesomest things about having so many different people um, that I'm cool with is that all of us, you know, we're all different in our own rights, but we all do amazing things. And I like to support everyone and try to, um, you know, show off everything. But that right there is also, yeah, that's Miss Betty, Miss Twin Mama, and Miss Danielle. They're going to be doing a show. I don't know what it's all going to consist of yet, but they're trying to get their subbies up for their new channel. And it's going to be it's a mix of interrogation room energy and glam confidence, like you're putting the world in the hot seat. So I think it's going to be amazing. I can't wait till I see them do a little bit more. Um, it's going to be a nice variety, I believe, Um, thank you, Miss Jill. A lot of the, um, I usually like to try to share everyone because a lot of the people that are in here are content creators. Miss CFM needs to get back on her stuff. I'm just saying, Queen. You listen to me. My Miss Twin Mama does a show. Miss Twin Mama actually, Miss Watcher of Crazy does a show. And Miss Mr. Let's see, trying to, we have so many different people a part of the communities that they're amazing content creators and they do a bunch of different stuff on their channels. Yeah, if Miss Jill said if you leave her a comment under her comment sections on one of her videos, if you're in listening ears and you're a content creator and would love her to subscribe to your channel, to her, whatnot, leave her a comment. She's working right now and listening. And so, go comment on each other's shit. That's how most people subby to each other. You know what I'm saying? I usually try to subby to everybody who subbies to me. If you did sub to me and I didn't, leave me a comment. Let me know. Say, hey, I'm a content creator. Would you mind sharing my channel? And guess what? Most time it's going to be, I don't mind at all because I like to share the wealth. There's enough of us on here to be able to support each other. I know it's hard to support everyone, right? But we can still support each other by watching replays. Let's say, we can't catch the live show right then. We could still catch replays, right? We can still go look at videos and shorts and things we like. And it still helps the other person's channel grow. So, there's enough of us to be able to do that with each other, support each other, as smaller content creators. That's how we grow. And I am going to get off here. I got to go do some things in town. I normally, y'all know I like doing my 2 hours, but I got to do some stuff in town. I got to take care of some business and, just be an adult. Shit. Sometimes we got to go to the grocery store. Sometimes I hate grocery shopping, but that's side the point. Y'all all have a blessed, beautiful day. I want to thank you all for being here. I want to send a shout out to thank you, Watcher. Thank you, Miss Crystal Ann. Thank you, Twin Mama. Hotspot, beautiful. Get to know, stop. Thank you, Miss Twin Mama. Again, thank you. Anybody who hit that like button, just being here, chilling with me, I want to thank every single one of you. I'm blessed to have you in my presence. And I want you all to know that you are very much so appreciated over here. Thank you to all my members, to all my subscribers, to all my bushwatchers, all my replay gang. Thank you. Leave me a comment if you got something to say. If you love the content, you can hit the Cash App if you so choose to. I do a blanket thank you to those who cash at me, and there's a reason why. I will never call out your full name or tell that you have given me one because I don't want people pocket watching you. And it's my way to protect you. Because they'll say, oh, you gave such and such, but only gave me such. No, I don't want people pocket watching and doing that to my supporters. So in my way, it's a way of protecting you. That's the way I feel about it. So know that I am always thankful for those. And I see every single one of them. Even if you don't hear me comment on it right away. I do, when I go check my phone, obviously see that. And I'm very grateful. I just want you to all know that if you've ever given me a cash up for any amount of reason, I am super grateful. I don't want you to ever feel like you're not appreciated or nothing. If you give something out of the goodness of your heart is not appreciated. I want you to know that just being here chilling with me, you're appreciated. And tonight I might do, if I feel up to it, game night tonight, if y'all are up to it. Let me know underneath this video after it ends, or comment under one of my posts if you would want to play some Jackbox games tonight and what time would be good for you. What your time zone is, like if you're Central, GMT, Eastern, whatever it may be, or if you're doing a live tonight, let me know so I can share you out and make sure people are over there because that's what I love to do. And I just want to say thank you all for being here. I hope you are. Also, I do need to share another one of my friends I think y'all will love. His name is Big Rig Slaps. Him and my bestie, The Hood Table. The Hood Table does a lot of amazing content. Love her to death. always have, always will. And they've been doing shows together recently, which I think is awesome. And I still ship it. But anyway, y'all have a blessed day. I'll see y'all later. Huggies. Bye.
I'm from the T-U-B-E-L-O. I'm reppin' my hood, so love I'm gon' show from the T-U-B-E-L-O. I'm reppin' my hood to the day that I go from the T-U-B-E-L-O. I'm reppin' my hood, so love I'm gon' show from the T-U-B-E-L-O. I'm reppin' my hood to the day that I go.
I'm from the west side, we don't need no introduction, this with the best ride. We all big boy rolling and holding, come take a test drive. Hilldale, Evergreen, Glenkirk, Outer Street, bending every corner on the west, and that's where I'll be. Sunroof back, checking seat banging down 1800, chunking up the deuce to my post slanging down on 1800. Show no love to the ladies that's training round on 1800, making time stand still, crystalline swinging down on 1800. Watching out for them knuckleheads that be staying round on 1800. Big rims and low pros be blanging round on 1800. Better completely change the way you're thinking about round 1800. Really hate to see you boys get left slanking around 1800. Out of street got some history, just let Captain C lay it out. If I don't finish it all on this one, let the second verse break it out. Remember the blue apartments from OG standing back there by 60 deep. Blue Walker, Charles Blue, a big Anthony Hughes and Pee.
I'm from the T-U-B-E-L-O. I'm reppin'